One of my students coded everything perfectly, but she still got denied. Why? Just one mistake, which is wrong POS code. So in this video, I will show you how to avoid those mistakes where you can't understand what is the reason for the denial. In this video, first we will learn theory, then we will see few example scenarios related to POS. So what is POS in medical coding? So POS means simply place of service. Why means in medical coding, whether it is facility, physician or ASC centers will get payment based on the POS. Hence, if you want to know and if you want to prevent denials, please watch this video until the end. So today, place of service codes every medical coder should know. Okay. So most of the time, accurate POS coding is essential for clean claims and proper reimbursement. So if you apply correct POS code, you will get proper reimbursement. So we have nearly 50 to 60 POS codes. So these you can find in the CPT book. Okay. So starts from 01, place of service code 01 and ends with 99, other place of service. Okay. So these mostly 50 to 60 POS codes. But among these, all are not necessary for us. We need only 10 to 15 POS are very important in live coding. So what are those? POS 11 is for office, doctor's clinic visit. 12 is for home, patient's residence. 21 is for inpatient hospital, admitted patient care. 22 outpatient hospital, same day services. 23 emergency room, urgent care visits. 24 ambulatory surgery center, freestanding surgery center, where this ambulatory surgery center does not have any connection with the facility or hospital. 31 is for skilled nursing facility, where patient will get rehab and nursing care. 20 is for urgent care facility, where patient will get walk-in clinical care. Okay. So POS 13 is for assisted living, which is for resident care services. So these are the most common POS codes we will encounter in the day-by-day coding. So why POS code matters here? So which will provide accurate claim submission and it will prevent billing errors as well as POS or correct POS reduce claim denials as well as POS will provide improved reimbursement efficiency. So because of that reason, everyone need to understand correct POS code for appropriate reimbursement along with coding using Icd-10 CM, CPT as well as Icd-10 Pcs. So what is the pro tip here? So always verify the POS code with the medical record. So as all of us know, incorrect coding can lead to claim denials as well as claim denials and delay getting the reimbursement. Just it is simple, accurate POS coding is equal successful claim. So these are the common place of service codes. Okay. So 11 is for office, example for routine checkups. 12 is for home, example home health visit. 21 is for inpatient hospital. So here patient will be admitted and patient will get the treatment. Example surgery and overnight stay. Next one is for outpatient hospital 22. So example for lab test or chemotherapies. Next one is for 23 emergency room. Most of the time patient will admit for broken arm treatment like ER for urgent care. So 24 is for ambulatory surgery center, which is a freestanding surgery center where patient will get procedures like cataract surgery. 31 is for skilled nursing facility, 20 is for urgent care facility and 13 is for assisted living. So I hope so far you got the importance of POS in medical coding. So now we will see few scenarios. Okay. So first scenario is POS 11 versus POS 22. So 11 is for office, 22 is for hospital outpatient. Here one of the coder coded 99214 along with 11. So 11 is the POS for office. Okay. So because of that reason, payment is $2,000. Okay. So which is non-facility rate. Okay. So actual service done on hospital outpatient department, not in the office. Okay. So here coder need to append 22 modifier along with 99214, but he has appended 11 office POS service. So here there is a $1,200 facility rate. So because of this wrong POS, facility got overpayment of 800. Okay. So what is the importance here? High audit risk. So payer may recoup money. So if the payer pays money also, he will recoup after some time, or if they found the error here. So this is the very important topic. Next we will see one more scenario related to ER versus office POS. So what is wrong here? So as all of us know, CPT 99283 is related to E&M coding, like emergency department evaluation and management services, but coder coded it as POS 11. Okay. So here hospital got 1800 amount, as well as actual setting here is emergency room. So 99283 we will use in the emergency room only. Okay. So here correct coding is POS 23. So instead of 11 here, coder need to put 23, as 99283 is completely related to emergency department evaluation and management coding. So here what happened? Here if you append ER or 23 at the place of service, hospital will get $2,500. Okay. So but what is the impact here? So but ER patient get $700 less or underpayment. Here there is a revenue loss for the provider. Okay. So that is the importance of POS. So if anyone looking for medical coding jobs in UAE, USA and India, please join in WhatsApp group. Group link is in the description of this video. Okay. And also if anyone looking for same day surgery training or IPDRG, SCC, C certification training, please send message to 707-526-3939. So we will see last scenario here. So here scenario 4, inpatient versus outpatient. So what is the wrong coding before the denial? So 99223 and POS is 22. So patient got $2,000 payment already. So here patient is admitted to inpatient. Originally patient is admitted. Okay. So here our correct coding will be POS 21. So as we have discussed previously, if the patient is admitted, which will become inpatient service. So here we need to append 21 POS, but instead of 21, here the coder appended 22. Okay. So here hospital got 3,500. Okay. So because coder appended 22 instead of 21, so hospital got $1,500 very less. Okay. And also there is a DRG mismatch and DRG mismatch risk along with this wrong POS application. So thank you team. Thanks for watching this video. If anyone looking for surgery, IPDRG, SCC, CCS training, please send message to 707-526-3939. And also if you like this session, please click on like button, and still if you have any doubt, please mention in the comment section of this video.